Welcome back to MidPoint. Once again, welcome infectious disease expert Dr. Macgregor-Skinner. Doctor, we did exactly what you said right now, and we're going to show our viewers this because you talked about going to the CDC website. Here is the checklist for patients being evaluated for Ebola virus disease in the United States. There's a whole lot of writing here, but there's not one stitch of video we can find anywhere on the website. That just shows to me and shows to the American people that this is an organization that was completely ill-prepared for this, did not do enough proper thought before this, and simply thought, well, don't worry, it'll get here, but we don't have to be that concerned. That's criminal in many ways, is it not?
It shows a lack of imagination. It shows a lack of people that I have a lot of respect for, who are, some of the world's experts work at CDC. But why isn't this? Where's this collective thinking? Why aren't they sitting down and brainstorming what's the best we can do for the American public? And we're not seeing that at the moment.
As a doctor and as someone who knows what goes on here with infectious diseases, when the CDC holds a press conference and tells us certain things, do you trust anything that's coming out of their mouth?
I used to work at the CDC. I loved working there. I have the highest respect for my colleagues there, but I don't see a team. I don't see a team of CDC experts sitting around. I'm sure there must be behind Dr. Frieden, the CDC director, somewhere, but it actually should be saying, we have all these challenges. Yes, we had some glitches in Dallas. Now we're going to flip this around and say, here are the lessons learned, and we're going to share those lessons learned with every staff member, every facility within the U.S. healthcare system.
So where do we go from here? I mean, all right, let's put blame aside for a minute and just stop even trying to go there, because there's way too much blame here that can be spread over a large area. So where do we go from here now when we have a spread and another possible here? How do we stop this?
Stop creating and fueling the culture of fear. Promote people. I've come back from Nigeria. One of the approaches of the Nigerian government was to treat every healthcare worker like a hero and promote transparency and honesty. And they took a whole community approach. And what I mean by that is, at the moment, we're focused on patient care. We're not focused on all the critical systems that are in place to get a patient into the hospital, to dispose of the waste, to take the blood from the patient down to the laboratory, to feed and every day, to dispose of it. How do they go to the bathroom? No one's told us that. And is it safe? And again, there's all these different systems that need to be in place that we're not hearing about. And so we need another discussion at the table to work out what we're going to do about this.
What's the biggest fear that you hear being promulgated around the country right now, being discussed over and over again?
The biggest fear at the moment is coming from hospital staff throughout hospitals throughout the country. They want to be able to say, yes, within our hospitals, we can detect, isolate, and prevent spread, but we do not have the facilities, the capabilities, the equipment to admit a patient for long-term care. Therefore, if an Ebola patient came to our hospital, we would be able to isolate them, but then we need a network, a functional network of how to transport that patient to a U.S. Ebola-ready hospital, and that's not in place at the moment.
All right, I want to get to transportation here for the couple of minutes that we have left. We now have a couple of people who have been testing for Ebola, the possibility of Ebola coming in via air travel, which many people have said for years is the way that a pandemic would most likely spread very quickly. A lot of these aircraft come to America. There's people who may be on it, may be suffering from Ebola. The aircraft themselves are not completely sterilized when there's a possibility of this. They take these aircraft, they clean them out, they give them a cursory cleaning, turn them around within a couple of hours here. Isn't that a danger? Something that if we've got a possibility of somebody coming in an aircraft, that aircraft needs to be taken immediately and sterilized and isolated, yes?
This is not just an issue for Ebola. This is an issue for highly infectious diseases. It's about to be flu season. Winter is flu season. We don't sterilize our planes during flu season to decrease the transmission of flu. So this is across the board. We need to look at how do we look at transport, and not just planes and aircraft, but across all the different types of transport we have to continually decrease the risk of the spreading of highly infectious diseases.
About a minute we have left. Congress has cleared $750 million to fight Ebola in West Africa. You have been in that region before. You have seen the reality of what this is. Is that enough to get this under control, or are we kidding ourselves?
Well, again, look, we've had over 8,000 Ebola confirmed cases in West Africa. We've had over 4,000 people that have survived, that have lived after getting this disease. Even in these countries where they're, as we keep getting told, the health systems have completely collapsed, they're still saving patients. We expect now through the mathematical modeling and the epidemiology information we have, many more cases. We don't have enough beds. We don't have enough community mobilization. We don't have enough people on the ground. I'm not sure what that 750 is going to be spent on, but it needs to be spent now, because the need to control the disease in West Africa is now, not next month.
20 seconds left. Can Ebola be stopped without American money and American troops?
No, not at all.
Not at all.
Not at all. No, we are the best at what we do in many facets. We're the best in health. We're the best in responding through foreign assistance. We have the expertise here in our 300+ million population. We need to mobilize many, many more people, and we need to do it in a coordinated fashion.
Dr. Gavin Macgregor-Skinner, it has been a pleasure. Thank you very much for your time. I'm certain we'll speak again very soon.
You're welcome.
All right, later on this hour, trying to make some sense of the roller coaster week on Wall Street. And after the break, 4 key Senate races, including one with lots of interesting money involved. It's coming up next right here on MidPoint.